Catch up with Christine Morgan now. She heads up the National Mental Health Commission. She joins us live from Canberra. She advises the Prime Minister on these issues. Thanks for talking to us, Christine. I must admit, it worries me greatly that we are seeing additional resources going into mental health, not because it's not required, not because we shouldn't be doing that, but we have an admission here that government action is creating mental health problems. So instead of remediating the government action, we're putting in more action to try and help people get through the mental health issues.
Now, that is an interesting way to look at it, Chris, and certainly let's just take that from the perspective that more services, firstly, are being provided for mental health needs, because I think the really critical thing here, and it came up in the last conversation you were having with Gigi, is that this is about people. This is about people and the impact on people. So COVID-19 is happening. We are responding. And part of what people are feeling is fear, absolute fear of the unknown. Part of what people are feeling is the impact of having to battle this for so many months. We're hearing about so much fatigue. And so much of this is about the consequences of the changes in our lives. So across that spectrum, we're dealing with the reality of people and our lives being turned upside down by something that we still don't know what is going to be the outcome and the long-term consequences of. So at that level, we need to tie together the fact that an integral part of us as being humans is our mental health, just like our physical health. And so as we go through COVID-19, we're throwing resources at meeting the physical health needs. Likewise, we need to be there for anybody who needs some help with their mental health. And
it's a good thing you're doing that, and I think everybody supports it. There's been a particular focus on Victoria because they've been going through this second period of lockdown. But I suppose my point is that the best thing for the mental health of Victorians when it comes to COVID would be to get rid of the curfew, to end the lockdown, to open up society so that people didn't have these additional pressures placed upon them.
Look, I think that what would be best for all of us is to find a way through. And I'm not being cute in saying that. What I mean by it is the fact that no two people react to this in the same way. So when we see an easing of restrictions, you see two types of anxiety emerging. You see anxiety from those who are saying, oh, is this too early? And then you see anxiety from those saying, I'm going to embrace it, but what will happen? So I think putting the politics of that to one side and looking at the very real human element here, it is impossible to be living through 2020. And let's not forget the impact we had with the bushfires. It is impossible to be living through 2020 without our mental health being much more severely impacted than it has been probably for years that we've known about. So I think that's really the issue here. Whatever the rights or wrongs of the way of responding to something, whichever way we go, you're not going to get unanimity from all people. So you will have concerns, you will have fears. That's where, as mental health experts, that's where, as suicide prevention experts, we need to step in and say, how are we helping the needs of Australians?
Now, is there a difference in terms of mental health outcomes when people are voluntarily isolating as compared to having it forced upon them? For instance, I've been speaking to young people in Melbourne who obviously don't have a great fear of the disease and they're willing to play their bit, but they're getting increasingly frustrated on their work arrangements, their social lives. They're forced into this isolation and curfew, as opposed to other people I've spoken to who are elderly or otherwise vulnerable, and because they know the disease is a real worry for them, they've deliberately isolated at home, often with some sort of family support, and they don't like it, but it's something they're doing by choice out of their own necessity. Is there differing mental health aspects from those sorts of propositions?
Look, you can't discount that as a factor, Chris, certainly, because our sense of agency is a really important one. So in terms of responding to it again, from a mental health perspective, and this is really important, we try to get this message out to people, is irrespective of the circumstances you find yourself in. And here we can look right across Australia and say that as we're sitting here in September, as distinct from March, we're all doing it a bit differently. But one of the most critical ways to try and protect your mental health, to protect your resilience, is to increase your sense of agency. So irrespective of your circumstances, what can you do to establish your routine, to maintain maximum choices that you can do? Recognising that's different for all people, but it's a really important point you've hit on, Chris, because it goes to the heart of how to develop your mental health resilience, and that is to have a sense of that self-agency.
And the timing couldn't be better for RUOK Day, which is later this week, and with all these pressures on us, we ought to be looking out for our friends and colleagues.
So importantly, in fact, one of the most important things that two really important things we've found as we've gone through COVID-19. Firstly, we have to hold on to hope. That is just a fundamental principle that we need to be able to look for, particularly our young people who are saying, what does the world hold? We need to say to them, the future is still yours. You can actually make a difference. The second thing is staying connected with people, and that concept of social connectedness, that we don't exist in isolated little bubbles just as individuals, but we are actually in a way in this together, though all experiencing it a bit differently. So as we go into RUOK Day, that importance of being able to actually have a conversation with somebody, to reach out to them, and if they say, no, actually I'm not okay, then being able to say, well, look, how can I get alongside you? What can I do to help? Where can we go with this? Is a really critical thing that I think has, again, been emphasised, and I think we will look back on 2020 and say that was a year where we learned how important we are for each other.
Christine, thanks for joining us.
Thank you.
Christine Morgan there heads up the National Mental Health Commission. Now,